Parents and caregivers, it's a pleasure to speak to you on behalf of Toronto Public Health. We appreciate your continued effort to help keep your children safe at school. During this presentation, I'd like to focus on hand hygiene, which is one of the prevention measures public health promotes to protect you and your family from COVID-19. It's important for you to discuss this measure with your child. If you as parents reinforce this message at home, then your child is more able to follow this measure at school, which will ensure the safety of not only your child, but also will protect others within the school community. There are three really important strategies to help protect us from COVID-19 that we'd like to ask you to help communicate to your child or children. There are other strategies, but these are the three that we would like parents to really reinforce to help children understand why they are so effective and why we need to be really diligent about following them. This includes physical distancing, face masks, and hand hygiene. Hand hygiene, or keeping your hands clean, is another really important strategy for keeping everyone safe because our hands can carry virus, especially when we bring our hands close to our face to move our hair out of our eyes or touch our glasses. Potentially infected hands can come close to those areas where the virus can enter the body, such as the eyes, nose, and mouth. By keeping our hands clean, we are providing another layer of protection where we're not allowing potential virus to enter our body. You'd think that cleaning hands is an easy task, but many people don't clean their hands correctly or for an adequate amount of time. Therefore, this is an important skill to teach children. After wetting their hands, they need to lather for 20 seconds and really scrub all the surfaces of their hands, including in between fingers and the backs of their hands. There are creative ways to teach children how long it should take to clean their hands. For example, the length of the time to sing a song such as Happy Birthday, twice. Soap is needed, friction is needed, and then at the end, we rinse our hands under the running water and use a paper towel to turn the taps off. Make sure that you don't touch the taps after with your clean hands. And once again, with clean hands, continue to avoid touching your eyes, nose, and mouth. As information changes all the time, please keep informed. Our Toronto Public Health website contains a lot of information to help guide you to make safe choices. Information is updated regularly to provide you with the most up-to-date information. The second link will provide you with more specific school-related information to not only keep your family safe, but also our schools safe. Once you're on the website, you can click on the tab Elementary and Secondary Schools, and then on Information for Parents. Additionally, if you have any questions, Toronto Public Health has a hotline, which is open 7 days a week from 8:30 in the morning until 8 at night. Or you can call Telehealth Ontario, which is open 24 hours a day, 7 days a week. We know there's a lot of information out there and encourage you to get your information from reliable, trusted sources. And finally, parents, I just want to mention once again that you're such an important part of our school community, and we at Toronto Public Health really value the partnership that we have with parents and schools. We understand this isn't easy, but we really believe that if we all do our part, we can get through this together. Thank you so much for your kind attention to this presentation, and we look forward to continuing to support you and schools within Toronto. Keep well.